afternoon. My name is Lynn Tong. I am an internal medicine PGY 1 at Willis-Knighton Health System in Shreveport, Louisiana. My abstract today compares the bacterial presence with the usage of 0.05% chlorhexidine gluconate lavage during urologic prosthesis revision surgery. First off, what is erectile dysfunction, also known as ED? ED is defined as the persistent inability to achieve or maintain penile erection. Some causes of ED include treatment for prostate cancer or enlargement, prior surgeries or injuries to the pelvic or spinal cord area, penile deformities like Peyronie's disease, and comorbidities such as heart disease or diabetes. Treatment for ED includes pharmacologic therapies, injections, pumps, lifestyle changes, and lastly, penile implants, which is also known as IPP. An inflatable penile prosthesis is the most common penile implant used to treat ED. It uses a fluid-filled reservoir with a pump and valve system to activate inflation and deflation. Although penile implants achieve the highest success rates in ED treatment, the possible presence of bacteria on the device itself or bacteria exposure accumulated during surgery increases the risk of progression into biofilm. Biofilm complicates bacteria eradication and may increase the risk of infection. This can ultimately jeopardize the implant and risk the implant removal. Currently, many preventative measures, such as different perioperative irrigations, are being studied to reduce the number of penile implant infections. Research has shown that irrigation at surgery lowers subsequent infection rates. Different solutions like saline, antibiotic, betadine, and hydrogen peroxide solutions have been considered. Interestingly, though, it was orthopedic literature that recently showed that CHG lavage has effectively reduced biofilm in artificial joint procedures. In our research, our goal was to see if there is any significant difference in bacterial presence with irrigating the IPP implant spaces with CHG. So if you can please refer to the image in the left corner. I don't know if you can see my cursor, but this image right here, you can see that at the very top, this is the reservoir that can be filled with fluid, and it's placed through an infrapubic incision line and placed between the peritoneum and the transversalis fascia. Then these are the two cylinders of the penile implant. And lastly, this is the penile implant pump that will be placed in the scrotum. So you can see it in this right picture. This is the scrotum, and this is the pump where you can press to release, to activate and inactivate. So we investigated a series of patients who underwent revision IPP surgery while utilizing CHG lavage for irrigation and compared the bacterial presence before and after CHG washout. Next generation sequencing, or NGS, a DNA sequencing technology, was also used to further identify the pathogens involved. We looked at 48 patients who underwent IPP revision surgery between 2021 to 2023. During the operation, a section of the capsule tissue surrounding the implanted IPP pump was first taken and sent for cultures. NGS studies were also sent out. After the implant was removed, all implant spaces were irrigated and washed out with 2 bottles of CHG. A second tissue culture was then obtained post-washout. We found that out of the 48 patients, there were 4 positive bacterial cultures and 13 positive NGS results before washout. This totals 65% of bacterial presence pre-washout. Using the NGS, the identified bacteria present appeared to be an even split between gram-positives and gram-negatives. Results of the post-CHG washout cultures were all negative with 100% bacterial absence. So in conclusion, it appears that irrigation with 0.05% chlorhexidine gluconate solution is an effective antiseptic that can decrease bacterial presence. And hopefully it will reduce IPP infections. Antiseptic solutions for prosthetic urology is currently a hot topic in the urology world. More studies with larger populations are needed for more comparison data but so far CHG has been the leading way in decreasing bacterial presence in urologic prosthesis revision surgery. Thank you.
All righty, thank you so much. We do have one question, and that is, are there any plans to repeat this study with either a larger sample group or maybe comparing different antiseptic preparations?
Yeah, so these penile implants are done by urologists all over, and it's kind of physician dependent on which antiseptic they would like to use. But so far it's with CHG, and it's just with the numbers of more penile implants that you can chart review and compare the infection rates and data. So with the urologist that I'm working with, we continue to keep updating the data and increasing the numbers and just analyzing the results.